o'clock, I'd like to go ahead and call to order the meeting of the Board of Commissioners for Whidbey General Hospital. This is our June meeting. I have a couple of points of order. Usually we've got two areas on the agenda for public comment. It's been consolidated to one. Didn't really see the need to have two separate. I thought it was just redundant. So we'll have general public questions or comments on item number 4 today. And I just want you to know that Mr. Bourne is videotaping the board meeting, so if anyone's uncomfortable with that, it's an open public meeting, so he has the right to do that, but I wanted everyone to know that. Any other points of order from the board? Okay, we'll move on to item number 2, consent agenda.
Move approval of the consent agenda.
Second. I have a motion and a second to approve the consent agenda. Is there any discussion? All those in favor?
Aye.
Opposed? Motion carries. Are you ready, Commissioner Gardner?
I am. Is it my turn?
It is. Item number 3 is education.
Well, the topic of discussion this morning is what is our responsibility as a board to ensure the best care for all? And I think that's something that we take very seriously from the beginning with our mission statement, one team, one purpose, caring for you being the entire community. So I would like to quickly review the information that they're talking about in the instruction book, that it is our role and responsibility to know what the community health needs are and to figure out how to deliver that care that meets the needs, recognizing that we have a wide variety of people, socioeconomic groups, people who have or have not got insurance coverage or have inadequate insurance coverage, that we have a variety of ethnicities, and that is often reflected in things like diabetes and health care, or heart care, and depending on racial background. We also have a variety of disabilities. So it is our responsibility to recognize the needs, and how do we do that? Primarily we do it through a partnership with the County Board of Health, and Greta's our representative there. And we were just talking at the last meeting or a couple of meetings ago that we would like to have a presentation from the Board of Health through Greta on what they're doing and what we're doing in conjunction with the survey that's being recorded. And we do these surveys periodically to find out who's in our community and what they need, which is our charge. We've done this in the past, and we've made good use of the information. We don't do it on our own because it would be replicating what the Board of Health does, so we work in tandem with them. So we are recognizing diversity. We are recognizing the community needs. We are seeking out more information on that, and we're addressing particularly the geographic areas. The south end, the central part of the island, and the north end really are like 3 separate worlds, and we recognize that, and we try to administer to those areas in recognition of the special needs. And that's why we have so many clinics. A lot of people don't understand, I think most people don't understand, that the vast majority of all health care on Whidbey Island comes from this institution. And we say Whidbey General Hospital, and people tend to think that we're the hospital, but we're not the hospital. We're the hospital, we're all the clinics, we employ the doctors, we employ the surgeons, we have the EMTs, we have home health care, we have hospice, we have community programs. One of the ones that's written up in the administrator's report is the wellness program, something I availed myself of last fall and would highly recommend, where you can just go in and learn how to live your life better, healthier, more actively, and just plain better. We have the Mary Waters that heads up that wellness clinic goes to the seniors luncheons on Wednesdays, 2 Wednesdays a month, and provides an exercise class for the seniors before their lunch. So we have quite a bit of community outreach trying to address the various groups. We have recently partnered with the Navy for surgeries. The Navy is now performing surgeries in our facility. And quite some time ago, they closed their emergency room, so we're providing all the emergency services for the Navy. So I think that we have a good history of seeking out the needs of the community and working to meet them. That doesn't mean that we're already there, but I think that within the financial constraints that we have, we're doing a pretty good job. We just need to do a little bit more and keep it up. One of the things that I was concerned about is the variety of languages that are spoken on the island. I was just talking a few minutes ago with Dr. Hansen about what they confront in the emergency room, and he says that they have a tele-interpreter available that they use for patients that come in. But he points out a need that we haven't met, that one is serious, and that is to have a sign language interpreter. I think that's something that we should be looking at, because we do have people with hearing loss on the island that use sign language, and we should have that available. It's part of the Americans with Disabilities Act. And it's, all these things are expensive. I know just from my association with the school districts that often they'll have 20 or 30 different languages represented by the kids that come into school there. And it's very difficult to have somebody who speaks every one of those languages. And you know, we could have a Spanish speaker, but in a medical community, it's better to use the teleinterpreter, because that is a standardized credentialed source, and there's always that difference between interpreting and translating. So I think that we've got the hearing community covered. It's the non-hearing community that we have covered. In our mission and in the very structure of our hospital as a community access hospital, our doors are open to everybody. There are no qualifications to get care from our doctors in their doctors' offices and their clinics. There are no qualifications to come into the emergency room. There are no qualifications to be treated by one of our surgeons or to be an inpatient here at Whitby General. And we don't say what kind of insurance do you have and gauge whether or not we'll treat you by that. And we don't say, well, if you're a Medicare or a medication patient, we won't treat you. We just treat everybody. Our first concern is their health, and we do obtain insurance information, obviously, but it's not a qualifier. And one of the things that we do every month is we in the consent agenda, we pass a report that is actually what we're writing off. And the charity care on this May report, the charity care is approximately $360,000. And that encompasses hospital charity care, Medicare charity care, the clinic charity care, things that we've sent to collection that aren't going to be collected, things that we've given up on, and because we know the people are never going to be able to pay the bill, so we just write it off. This is a part of our mandate, is to take care of all the people of our community. So I think that what we're doing now and what we aspire to do meets very well the criteria enumerated in this critical question that I'm addressing today. And one of the things that we have is a strategic plan, which does start with our mission statement, the one team, one purpose, caring for you. But what we aspire to is an exceptional patient experience using best practices in partnership with our community physicians and other healthcare providers, the 3 regional centers of healthcare and 2 rural health clinics, community outreach program to educate and support community members, improving the quality of their lives and easing their passing. And this is something that we feel that we've been pretty successful in doing. We recognize physical geographic coverage, diversity of communities' perceived needs, and the aging of our community. And we explore new or expanded healthcare services and collaborate with local healthcare institutions and providers to provide support for needed services in our community. So that's right there in our strategic plan. Some of the things that we're doing, we're always looking for opportunities, and for that it's not necessarily the board, it's our staff. Our staff has been outstanding at looking into the community and seeing where we can do better. We just had a report, I think last month, from Dr. Gibson about the reduction in the cesarean deliveries. That's been a goal nationwide to stop the unnecessary cesarean deliveries, and Whidbey General has just done an outstanding job and has been recognized for the progress that we've made already. Of course, we have the Women's Heart Health program that's been going on now for a couple of years that brings heart health to women who ordinarily couldn't afford to come in and have the tests and perceive that it's not available to them. And we've gone out into the communities to make sure that they understand that this screening is available to them at no cost. And this was a program that was also started by staff members, and it has won awards all over. The MAC, the ambulatory clinic, has also innovated quite a number of procedures and programs for which they've won awards. So we have a staff that really we can't recognize enough for going out and above and beyond their job to see what else they can do, what else they can do for the community, what's not being done, where the gaps are. And we really applaud them for that effort. We really rely on it because they see it better than we do. We're a policy setting board, and we're the overview. We're not in the trenches, and so we do rely on staff, and boy have they come through. We're really very proud of them, and we really appreciate them. We try to take every opportunity to tell them that. So I was really pleased with this question because I think it's an area where we really shine. I think that the Whidbey General Association of Medical Services, or whatever you want to call it, has done an outstanding job for this community. It's an organization that was started by the community because the community saw the need. People who didn't know how to start a hospital started this hospital. And through the years it has grown and expanded through the support of the community and the hard work of a lot of people who've served as employees and on board. And I think we're doing a good job. And we are also committed to not resting on our laurels, but to continue that legacy that we have accepted from those that came before us so that we can do even better and even more. So I think we're doing fine. And we'll look forward to Greta's report on how we're working with the Board of Health.
I guess.
And we talked about Community Health Advisory Board. Maybe coming.
Yeah, I think for them to come in and their own presentation, will do an outreach to them to show that we're really attentive. The survey that they're now drafting is due to go out in the beginning of July. We've had people from Whidbey General involved in the not in the board itself, but in the teams that help create the assessment tool that will be introduced. But there's no one that sits on the Citizens Advisory Board from the hospital, which might be something to consider. Because they have a team that does the grunt work, and then there's a board, CHAB board, that reports to the Board of Health. And I sneak into the CHAB because I'm on the Board of Health, so I can't be on that board. But there are many levels of it, and I think it makes a difference in how one can contribute to both the thinking and the process. So of course I give my 2 cents worth.
Shocking. It's such a good board, or tool, the Community Health Assessment Board, and then the people that are on that board. It's all volunteer.
Yeah. It's
And
amazing.
I'm not sure how wide the diversity is on the board of experiences. It's been a while since I looked at all that, but as someone who sits on the Board of Health, you get to see the applications.
Well, and that was one of the reasons sitting on the Board of Health was looking at how the data is consolidated. And because so much emphasis is on the young, and since we are aging, it's trying to make sure that there is a component of representation from the seniors. And there now is somebody who is applying who's from the senior group.
Oh, good. That's really good.
Yeah.
So do they have vacancies on the board? I mean, if somebody from the hospital wanted to be on the
It's
CHAB?
not by vacancy.
Okay.
You apply, and then the application is reviewed by the board. It then goes, the CHAB board, and then goes to the Board of Health. So there's no restriction, and they can even move rooms if there are more people that interested in attending. But they really do great work.
And there are always spots available. And they don't represent different areas of the island. It's island-wide. It would be nice to have a seat at the table. I'm not sure how administration would like to follow on that, or who you think might be the best person. It might be good to, they would probably like to meet you at a CHAB meeting, so it might be a good place to go to.
Or through
To
Keith
assess.
Hickman. Because I don't know that attending a CHAB board meeting would be that useful. Depending on what they're working on.
Depending
I know in the past Trish Rose has been very involved with CHAB. Now that she's back, I think she'll revisit that opportunity.
Of course, yeah, and she was on board, but was,
Oh,
Yes. Okay. That would wait until your question, until we were done discussing.
you couldn't, sorry,
I did.
I wouldn't have been offended.
So is there any more discussion around George's presentation?
the one thing I was wondering about in this particular chapter was the reference to both the IRS requirement and this H, it was a format that we were supposed to.
What page were you on?
I don't know, 111?
That's the, oh, no, that's the new one. So, yeah,
Because there were two things that they addressed. One was.
Oh, yeah, the 990 and the Schedule H.
Yeah, the Schedule H. I was just wondering what that Schedule H.
Schedule H is the 990, of course, is our tax return, our non-tax return. It's a nonprofit reporting to the IRS, and Schedule H talks a lot about our programs, our intent, our purpose.
So the
what we're
programs
doing.
that you identified are listed on
It
that?
wouldn't be listed in that great detail. It would say something to the effect, I haven't read it for a couple of years, but it says something to the effect that as a critical access hospital, we are open to provide services to all persons regardless of their ability to pay for care, that we reach out to the community and address various socioeconomic groups. Diversity will be mentioned. The breadth of care, which would be basically from childbirth to hospice.
So all of these are identified on the Schedule H?
Yeah, it's a paragraph that kind of sets out relatively briefly the scope of our services.
Well, I'm glad I'm not a CPA.
Well, Moss Adams writes it for us, so we're happy that they do.
Thank you.
Thank you, Georgia. I'm liking this book. We're almost to the end, so I think it's time to start thinking about what we might want to pursue going forward. Which leads me into maybe talking about a little bit later in the meeting some of the things that the Hospital Association Governance Board is undertaking. So we might be able to stick some of those in here. Okay, at this point in the meeting, we're on item number 4. I will open the floor for general public questions or comments. Mr. Bourne?
Rob Bourne, Green Bank. I'm hoping at some point the citizenry will get some status reports, including when the dashboard reports will be posted online, the progress on scheduling the evening question and answer session, that public forum type meeting that you promised. I'd like to know whether the nurses are still working without a contract and perhaps the status of those negotiations. Plan for surgical offices. Do we intend to maintain 3 orthopedic and 3 general surgeons? And when might we be back to full staffing? And how are things looking for assembling a permanent administrative team? Finally, I'll just mention that we had another newspaper article where Whitby General was featured as not submitting any financial reporting information to the state auditor's office for the last 4 years in violation of state laws. This morning before I came here, I received a comment from an anonymous citizen, and it says, sadly, during the last 15 years of my association with WGH, I find most of the administration and Board of the Commissioners' attitudes are that they are above the law, whether it be federal, state, or local mandates. Perhaps our CEO at some point could comment whether she thinks we should be complying with state laws. Thank you.
I think most of your questions will be addressed as we move through the meeting. Do you want to comment on that later?
Oh, well, I would like to just clear up, there's a misconception about that we haven't been reporting to the auditors. We're required to provide our audited financial statements along with the MD&A and the footnotes to the state auditor by the 31st of May, and that has been done, and it has been done every year forever. I don't think we've ever been late. And we also provide other documentation to them. The state audit is also completed in the fall and is available through the auditor's office. There is this misconception about this other program that the state auditor has, and those of you who have businesses, and I'll bet you've received one, it's a survey type thing where they want all kinds of information about your business, but they want it in this really weird format, and they want it posted to a website that is really hard to use. And what it would take is we would have to take the financial statements, and the format of our financial statements is mandated by the state auditor. We have to do things in a certain order. We have to include things in a certain order. We have to have all of our accounts listed in a certain format. And this other alternative website is a completely different format. So what you would have to do is you would have to take the Moss Adams audit and or the state audit and take all those numbers apart and completely rearrange them into a completely different format. Then of course you'd have to check them to make sure that everything was included and everything was added accurately before you posted them onto this very difficult website. And what you find is that this is a task that takes not just hours, but days. And both private businesses and public entities, the municipalities, everybody has asked the state over and over and over and over again, just let us put in our financial statements in the format that you require us to prepare them. Don't make us spend days and weeks reformatting them. And the state has not responded with this. They use it for survey purposes. It's not that the information is not available to the public, it is available. And if you don't like what's on the state website, and we will be posting these as soon as we get the final draft copy, or the final copy from Moss Adams, we'll be posting them on our website, but GuideStar also publishes financial statements in 990s. So they're really, the information is available all the time. The only place that you're finding non-compliance, and it's not just non-compliance by the Whidbey General, it's non-compliance by just a significant percentage of both the public and the non-public entities, because it is so hard to do. And when you're in business, I find the businesses non-compliant, and they send you a letter that threatens you if you don't do it, but nothing ever happens if you don't do it.
And it's a really worthless entity.
It is
And
worthless.
The bad thing about it is you spend all the time and money to try to figure it out, and once you figure it out, that's when they'll change it. It's kind of like along lines of the federal government. It's like once you figure it out, they like to take their systems, once they're figured out, you get it running well, then they change it.
Well, you know, you're always hearing about unfunded mandates, and this is a huge one, because when they tell you to do your financial statements in this format, and then they say, oh, but now we also want you to completely turn them inside out, upside down, and post them on this website.
The important ones so far turned in, and that, you know, the Moss Adams reports, those are the key ones.
And most of us that have had to deal with that website get a little hot under the collar, because it is a waste of time. It is a replication of information. It serves no purpose, and we'll do it, but we'll do it as time allows, in my opinion. I'm not telling Jerry what to do or what not to do, but for me, for my clients, and for the other public entities I've been involved with, you just can't drop everything you're doing to spend a week or more reformatting your financial statements to put on a website that nobody uses. So I don't think that that's an indication that we're not following the law. We're following the law as far as the state audit and the independent audit, and that survey website is just going to have to be not a #1 priority. At least for this board member, it's not a #1 priority.
Well, we talked about this at length in finance, and the number of man hours that it would take to rework all of our financial numbers and the cost to the institution. And we did not make it a high priority.
Well, what are you going to do? Are you going to quit collecting your receivables? Are you going to quit billing? You know, what task are you going to put aside so you have that kind of time in our accounting office in order to do something like this? It's just, it's not good business, in my opinion. Just my opinion.
I think there are others that agree with you. It's basically a waste of time to have to reformat everything, especially when the state has initially told you how you have to present your reports, and you comply with that and you send those in, and then, as you said, they're asking you to turn it inside out and upside down and report it here for what purpose? No purpose at all, really.
And it's so hard to do that and then proof it. It takes a number of people and a whole lot of work to proof something that's, because there are so many, literally so many numbers in it. It's just, if we're not reporting or not reporting timely, I have to say we're in really good company, because look at everybody else who isn't reporting too.
And one thing about the following the law, this board is always going to educational seminars, whatever. And I think I've been on the board for 8 years, and it always takes 3 members to make any changes, to pass anything. And I have never in 8 years seen anybody on this board intentionally try to circumvent or bypass a law. I think we've done an excellent job at trying to adhere to all the rules and regulations. And it's difficult, that we do not work 40 hours a week at this hospital, but we do a good job of really trying to make sure that we comply with all the laws. And we've got somebody here that corrects us, even if we go into executive session, that we follow the law. So I resent that for partly.
Well, I'm not even sure it's a law. I know it's a directive.
I'm
not sure it's a law.
We do a really good job of trying to educate each other and ourselves on what the rules and regulations are and laws, and we try to keep ourselves out of trouble that way. So I do commend the rest of the members on the board, but I think we do an excellent job.
And we have Dale here to keep his eye on it.
It's not a full-time job for you. Are there any other questions that would like to be addressed?
Hey, good morning, I'm Dr. Wagner. Just wanted to bring to the table here the fact that I did request a bunch of documents well over a month ago. One of the issues was an email address, but that was corrected. In light of that, in the last few weeks, I've only received one document, which is apropos to today, because Ms. Forbes will talk about the financials, and some of the discussion this morning was also regarding that. So I'd like to ask a few questions. Hopefully, if you can answer them, great. If not, at the next meeting. First of all, is that, let's see here. Apparently, there's a, we've had a lot of healthcare reform, and it's going to impact the bottom line here. I notice on your liabilities portion of your spreadsheet here that you have an outstanding debt of $1,045,000 for your bond, and it looks like per month, I've only got 1 month to compare, but it goes up $260,000 a month. Could somebody, to me it looks like we're spending $260,000 a month right now on the bond initiative that was exercised. Is this, am I reading this correctly? And if so, where's this $260,000 a month going?
Do you have another question?
Well, I have about 5 of them, so
Okay, but
we can go one at a time.
If you would give us all the questions, and they may
Okay,
be addressed
sure.
in the financial report, and if not, we may answer them at the next meeting.
At the next meeting. Well, this should be information you guys should be able to
Would you
answer now,
please?
because
Sir,
you have this
sir.
information readily available, and you're the board of this hospital, so you should be up to date. One of the
Sir,
responses...
would you please ask your question?
I am. I'm finishing my question. One of the responsibilities of the board is to understand the financials. It's nice to hear all the accolades about your community projects, but that doesn't make the bottom line of the
We have a
hospital.
finance report coming up later in the agenda, so if you would ask your questions, that would be appreciated. Thank you.
Okay, I'd also like to know what is your operating budget right now in terms of how much in debt are you? I've heard, from numerous people both here at the hospital and elsewhere, it's hitting $5 million. But again, I'm sure you have this on paper and you can share it with the public as well. You also made comments earlier this morning that everybody not everybody, but the majority of people on Whidbey Island get taken care of here at Whidbey Island, at Whidbey General Hospital. Well, again, from very limited amount of information I've got, perhaps you can help clarify that. And do you have demographics on people from the South Island and North Island as to where they go? We're making comments here that Whidbey General takes care of Whidbey Island people, but that's not what the consensus is, that that I've been exposed to. So I'd like to see some demographics showing that people north of Oak Harbor don't go to, Anacortes, and that people don't take the ferry over to Everett, and that this hospital serves the whole community. So maybe you could help clarify that as well. You also made comments that the base hospital has changed in some respects, that they don't have an emergency room anymore. How has that impacted the hospital in terms of how many more patients have you seen? Second of all, is you said that the general surgeons are doing surgery here. What are they doing at the Navy Hospital? Are they doing nothing anymore? What is, I'd like to have an update on that. And then last of all is you have legal costs on here for this 1 month of $989,000 for what's called third-party settlements. Could you explain what this almost $1 million liability is and what it's used for? And that would be really helpful as well. I think that's pretty much all I have, and hopefully all those can be addressed. Thank you.
Dr. Wagner?
Yes.
We will answer those questions in the financial
Okay, great.
section.
Thank you.
Are there any other questions or comments from the public? Okay, hearing none. We are going to move on to item number 5. Dr. Gibson?
Good morning. I don't know if you would like for me to attempt to answer Dr. Wagner's questions around the contract of the Navy Hospital. I'm prepared to do that if you wish.
Sure, go ahead.
The WSNA, our nursing union, and the hospital are still in active negotiations. And we will never be without a contract because our current contract states that we work with the one we have until such time as we have a new one. Negotiations this bargaining season have been extremely difficult for every single hospital in the region, and it's taken longer than it has in years past, but we don't anticipate there'll be any difficulty reaching a good, mutually beneficial agreement with our unions. We respect our nurses. I'm one of them. I care very much for them, as does everyone on this board and everyone in administration, and we're looking to achieve a good result that's within the economic realities in which we live. The Navy Hospital is only doing obstetrics and primary care at this point in time. They have outsourced all their other surgical and specialty care. Some of it is done at Island, some of it is done at Bellingham, much of it is sent to Madigan if it's elective, and we do orthopedic and general surgery for them on a weekly basis. We do regular surgeries for them. You asked about the impact on the emergency room. Dr. Hansen can probably answer some of that as well or better than I can, but there are 3 reasons why our emergency room business has gone up to about 21,500 patients a year last year, and the Navy is a portion of that increase in the ED visits, and I'm sure he can speak more to that when he has his report. I'd like to advise the board that after a long search that was well worth it, we've appointed Jeannie Sandahl as the Director for Emergency and Trauma Services. She's a master's prepared nurse with many years of experience in an ER much like ours, and joins a very high quality group of leaders who also have a great deal of education, as much or more than any other hospital where I've been privileged to work. She has the energy, enthusiasm, and excitement and interest that will help us to get to our next level of achievement, even though it's fairly high at this point. Probably you'll hear from our CEO that we had the privilege of being visited by 3 different regulatory agencies in the last several weeks, and they had good results. The CMS and DOH survey, which is an unannounced survey that happens every 3 years, we were recertified and received notice of that, and that's largely based on our quality and our physical space. As you know, it's an older building, and we do have some things to fix, but certainly nothing major and nothing that can't be readily addressed, and so we received our recertification. We had our trauma survey as well, and had folks from several different states come and look at our trauma program, and everyone kicked in and did a great job of presenting the work that we do in trauma here on the island, which is substantial and very high, with very good outcomes. And then we did have a DOH visit looking at our staffing, which directly relates to quality in my report, and they found no issues or concerns with staffing. They found our staffing to be, if anything, generous in terms of how we compare to other hospitals in the region. I'm happy to tell you that we are actively engaged in a lot of educational priorities at this point. We put another cohort through the end-of-life care program. We had a large cohort, I think 2 at this point, that have gone through CPI training, which is a training for de-escalation of patients who are aggressive or violent. And we're actively working on a community-based program for dementia for the very large population that's at high risk. We have one more course to do, and we will be able to qualify to be a CEU provider, so we will not have to go through other agencies in order to provide CEUs or contact hours for our professionals, much like the medical staff does for CME. I'm going on Friday again. It's my privilege to serve on the governing board of the North Sound Accountable Community of Health. And we're making progress. The project that we decided to focus on was boarding of mental health patients in the emergency department. And we've been able to achieve several things based on our collective work. And that is that we now have the mental health patient population being entered into the EDDI program, the program that allows the physicians to access a patient's prior health care and their plan of care by their primary provider, which will allow them to take better care of mental health patients. And we also now have mental health beds posted on the WatchTrack website, which lets us know how many beds are actually available, because as you know, we don't have enough, and it helps us to know whether or not we have the opportunity to really admit a patient or where we might be able to send a patient, which was not previously available to us. The Patient Advisory Council, we received about a dozen applications. We're looking for about 10 members. We'll close down, the plan was to close down the application process by the end of this week. If you have anyone that you believe would want to serve on that committee, there is an application process. Just have them call Jenny and she will take care of that for them. And unless you have questions, that concludes my report.
So what are the duties of someone on the patient advisory?
We hope that it will be people that have either been in the hospital or have had family members in the hospital, have used the hospital, and their duty is to really give us honest, straightforward, critical feedback so that we know how we can improve our patient satisfaction with their experience, and also what the community's interest in how the hospital grows and develops is, so that we can provide the kinds of programs that they're looking for, in addition to improving their overall experience with existing programs.
So they're going to have regular committee meetings, is that the?
We're hoping that they'll be quarterly, so it isn't too much of a burden. We'll probably have some subcommittees that'll be working on specific areas of interest, depending on what their specific areas of interest and concern are, that might meet in between times and do some homework, but hopefully will not take too much of their personal time. But we want people who have a commitment to making the hospital as good as it can possibly be, and we want to have them have a voice.
I'm really excited that you've got that program underway. It's been used really effectively in other institutions, and I know it's a lot of work getting the process going and organized, and I thank you so much for doing that. I think it's going to do well for the community. I think it's going to do well for the staff here, so that they understand what the community wants. Thank you. Thank you very much for that. Your North Sound Community of Health was a great conversation topic at the Washington State Hospital Association Governance Committee meeting. We had a presentation by their VP of Communications and Public Affairs talking about the importance of getting to know your communities and the good work that's going on with the grant that you received in our state. And our state was one of few states that were chosen to participate in this, so it's wonderful that we've got a seat at that table.
And we're only one of 2 right now that's been fully vetted, and it involves Islands, Snohomish, Skagit, Whatcom, and the San Juans. And we all meet often and communicate regularly, and it's been very helpful.
Dr. Gibson.
Yes, ma'am.
Are there any questions regarding Dr. Gibson's report? Thank you. Dr. Hanson.
So we'll start with the business first.
Okay.
Answer your question that were posed. So, for credentials, we have lots of reappointments this month. Ann Danmore, these are active staff reappointments in internal medicine. David Lemmy, active staff in family practice. Maninder Mahal, active in internal medicine. And Lydia Thorson White, which is also active in internal medicine. And it's all been recommended for approval.
Move, go ahead. Move approval of the active staff reappointments.
Second.
Okay, we have a motion and a second to approve the active staff reappointments as read. Any discussion? All those in favor?
Aye.
Opposed? Motion carries.
Okay. For courtesy staff reappointments, Stephen Woods, gastroenterology, and then Patrick Cox, radiology, Ross Ondersma, radiology, Eric Ray, radiology, Karen Stone, radiology, and Scott Vanderheiden, radiology. These are all courtesy appointments. So we recommend.
Move approval of courtesy staff reappointments.
Second.
Okay, we have a motion and a second to approve the courtesy staff reappointments as read. Is there any discussion?